Dr. Matt here from Rubina Chiropractic Wellness Center. Today I want to address a question I had this week. How do we as chiropractors know where to adjust? So sometimes the patient comes in here, we adjust something in the lumbar spine or the thoracic spine or the cervical spine, and the patient wants to know, how do we know where to adjust? There are so many different vertebrae in the spine. How do we know which one to adjust? So that's why obviously we've got to go through an extensive amount of training to know exactly how the biomechanics of the spine work. We need to understand the anatomy and the physiology and the pathology in the spine. But then also we've got to use various systems to tell us exactly what we need to do. We need to do the x-rays, and that's why everybody gets x-rays done with us, to make sure we can see exactly what's going on. Then we don't have to guess. We can see the alignment of the spine, the curves of the spine, and we can see what's the driver on the dysfunction or the pain that you're specifically having. Then we can look at orthopedic testing. That could also give us an indication of what is going on, where we need to go for the adjustments. And then we follow what we call motion palpation. So motion palpation will tell us exactly which joint segments are moving, because we've got to restore movement back in those specific segments that are not moving, if they are segments that are causing some of the dysfunction. Because randomly adjusting the spine might even make it worse. So we've got to be very specific at these adjustments, at a specific angle, the specific vertebra, and that will give us the best possible outcome. Then we can use some static palpation, we can use muscle testing. So it's an art, and that's where chiropractic is quite unique, where it's all about the philosophy, the art, and the science. And combining all of that, we give you the best possible adjustment, the best possible outcome. See you next.